Hi there, it's Derek here at Midlands Physical Therapy in Moat, and in this video I want to talk about the importance of sticking to a treatment plan and also not just focusing on pain relief when you want to get back to doing the things that you love to do and ensuring that the problem does not return. So I had this situation with a patient about 2 weeks ago. They originally came in to me a few weeks ago with a back problem that had been going on for about 4 or 5 months. Now this person loved to cycle and they'd gotten to the stage where they weren't able to get onto the bike anymore because the back was getting too uncomfortable. And when I assessed them, found out that there was a number of things going on. The muscles at the back of the leg weren't working as well as they should. Range of motion in the ankle was not good. Range of motion in the hip was not good. So overall, their treatment plan was working out at about 6 to 8 sessions to get them back on the bike without this problem coming back anytime this year. They agreed to that. It made perfect sense to them at the time, but about, I think it was 3 sessions in, I got a message saying that their back was feeling great, that they were back on the bike, they were able to cycle. They went for a cycle that week and their back was feeling perfect and they didn't think there was any need for the rest of the sessions. Now, the problem with this is that even though their pain was gone, pain is often not the true cause of the problem. So you can have pain in an area where there is nothing going on in that area and the problem can be coming from somewhere else. So in this person's case, the muscles down at the back of the legs were still not working as well as they should. There was still an issue with the ankle and the hip range of motion was still not as good as it should. So even though they had no pain, if they just stopped the sessions there, in about 2 or 3 weeks time, this problem is going to come back just as bad as it was the first time. So if you think of it like antibiotics, when you go to the doctors, you get a course of antibiotics. You might have to take them for 14 days. After 6 days you're feeling great, but you're told stick to it till the end of the treatments, because if you don't, the problem is going to come back. It's the same with the treatment plan. If your goal is to get back to doing the things that you want to do, that you love doing without it coming back at you, you need to go through a step-by-step progression where you are able to do a certain thing, then you go off and practice that for a few days, come back, if you're able to do that, perfect, then you go on to the next step, then you go on to the next step, and you load up the body and you get the body strong enough so that it's able to do all the stresses, all the things that you throw at it, it's able to do them and the problem doesn't come back again. So I hope that makes sense. If you've experienced this before, you may have had a problem and you went for a massage and you felt great after the massage, but then 2 days later it came back at you. That is what happened. Your body was not exposed to the levels of force, I suppose you could say, that it needed for you to walk or for you to play or for you to cycle or for you to, even if you have to sit down at a desk for 8 hours, there's a certain amount of force and a certain level of endurance that your muscles need to be able to tolerate to keep you in that position without you getting sore and without you getting uncomfortable and stiff. If you have any questions at all, please do get in touch. I hope this video makes a little bit of sense, and thanks for taking the time to watch it.